of us, brushing our teeth is second nature. It's the first thing you do when you wake up, and then it's the last thing you do before you go to bed. But listen to this. Most adults actually fail in the oral hygiene department. So we're here to help. New York City periodontist Dr. Greg Diamond is here to teach us all the ABCs on properly cleaning our teeth and getting that beautiful smile that all of us want. And of course, we'll trust him. Look at his smile. It looks great.
Thank
so
you,
of course,
Anna.
we have to trust you. So right out of the gate, I thought the main reason you brushed your teeth was for cavities. But it turns out that's not true.
Absolutely not. Really, the main reason we're brushing today is to reduce inflammation and prevent periodontal disease.
Ooh, and that's a very serious thing as you get older, I know that. So let's talk the basics. I thought a toothbrush, all were created equal. But that's not the case?
No, not at all.
Of course not.
We actually have different styles. We have different heads. And what we recommend is the use of a small bristle toothbrush because of the easiness to get to the back of the mouth.
Ah, so with the bigger one, it's a little more difficult to get back there.
Very difficult.
Okay.
Those are high-tech toothbrushes that are sitting out there that people love because they look great.
Okay.
But actually the best on the market are the small bristles.
Okay, so what about actually brushing? Is there a certain technique that you recommend?
Well, generally we recommend a 2-minute cycle of toothbrushing.
Okay, I had always heard 1, so you need to do 2 minutes.
Absolutely. We know that it takes about 2 minutes to remove that bacteria on the teeth, which create the inflammation. And the way we generally brush is we usually use an electric toothbrush, and we'll use this brush on a 45-degree angle, both on the gum and the tooth.
Okay.
And the advantage of doing that, it removes the bacteria on the gum and the tooth to prevent that inflammation.
Okay.
And we hold that for approximately 2 minutes, and we have this great little timer here, which actually can sing, it plays games, and it lasts for 2 minutes.
Especially
and people
for
love
kids.
It. They
people
love
really
it.
like
They love
that.
it.
Okay, so what about flossing? I know I always hear you need to floss every single day.
Well,
Do we?
flossing is a necessity. But floss comes, whether it's waxed, unwaxed, there's so many different types of flosses, it really doesn't matter, except if you had very tight contacts and you couldn't get the floss between your teeth. One of the things we always recommend is that flossing is done in a upward and downward motion. We actually form a C around the tooth, almost in a hacksaw type of motion, and we always extend that floss under the gum tissue. The reason being we want to remove that bacteria between the interface between the gum and that tooth.
All those little food crevices.
All those bugs.
So what if you don't like normal floss? There are other ways and other things you can use, right?
Absolutely. We have all kinds of instruments today. We have something called interdental brushes. These are great, and they come in different sizes. Yes. These are fantastic. These can be used instead of floss because they clean between the teeth, they clean the cracks between the teeth, the grooves, and more importantly, patients with braces, patients who have wires on their teeth.
Oh, okay.
Great instruments.
You need those if you have something like that. Okay, so there are lots of options for flossing. Now, this is a big one because I have to show you what I'm drinking today. Bottled water, and a lot of people out there drink bottled water constantly.
Everybody drinks bottled water.
I know. So
I drink bottled water.
You do, but it's bad for our teeth, right?
Well, it's not that it's bad for our teeth. We don't get the fluoride that we need from bottled water. So we have different devices on the market that we can hook up to our faucets, and we can filter water, remove the bacteria, and yet the fluoride can still come out in your drinking glass, and you can still have your water.
It can still be clean.
10 times a day to keep you happy. It's there.
Okay, so what about mouthwash?
Mouthwashes are fabulous. Fabulous. Okay. I recommend everybody uses a mouthwash. There's different types of mouthwashes. They are made out of natural ingredients.
Okay.
Some have alcohol. It just depends on patients, what they prefer at any given time.
Okay.
But every patient should be using one.
Okay. Well, all great tips. Now we know about brushing our teeth. And for other ways to get those perfect pearly whites, go to BetterTV.com and click on the link. Thanks again.
Thanks again.